We're halfway through 2025, and there has been a ton going on. Congress is on its recess, so let's review what's happened so far. First and foremost, I'm Emma Peterson. I'm a partner here at Chisholm Chisholm Kilpatrick, and today I'm joined by
Maura. I'm also a partner here at CCK. Emma and I have been working with veterans here at the firm, me for 9 years and Emma for 10, 11? 11 years. So this is the backdrop of our information and experience we want to bring today. As Emma mentioned, we're going to be talking more about 2025 developments, but that is all with the intention of hoping to bring good information to you all. We keep these things in mind when we're handling a very high volume of claims and appeals here at CCK. We have a very robust team that handles cases before the agency, also before the U.S. Court of Appeals for Veterans Claims. Happy to be here with you today. And Emma, do you want to start us off with our first item to talk about today?
Sure. Today, we're going to talk about an issue that's been in the news for the last several years, and that's veterans' referrals to community care. Is no longer going to require an additional doctor review. So vets seeking community care in their communities, as opposed to going to a VA medical center, will no longer require a second level of review and authority to get that care.
And as background, VA care through VA medical centers is pretty standard. There are also options for veterans to attain care through community providers. So this is actually a question that we get a lot from current clients and others. To what extent do veterans' benefits enable claimants to seek community care? So community care is a really good option for those who maybe don't live close to a VA medical center, who want to work with a specific provider in the community. And as Emma mentioned, historically, the requirement has been to have this second referral layer. So every veteran, in order to get that outside referral, needs 2 doctors to basically sign off on that. That's a lot. That can cause a delay in the process of receiving care. And so I think one of the pros of this new approach, where there's only one referral required, is that we're going to be able to see veterans have easier, quicker access to those community care referrals that are really important for veterans, especially in communities where community care providers are more accessible than VA providers.
That's right. And so this change went into effect, was mandated by Congress in December of 2024. VA has announced it's going into effect now in 2025. And as you mentioned, it allows eligible veterans to receive medical care from non-VA providers in their local community. And so there are some pros and cons, but let's talk about what this care is and how it's authorized. So it's paid for by VA under specific conditions. So if VA can't provide you care at your local VA medical center in a timely manner, if there's a super long wait, or you live in a location that's very far away from a VA MC, they might authorize community care in that instance. If VA doesn't offer the specific service or specialty that you need, think maternity care, maternity wards, VA medical centers don't have those oftentimes. They'll authorize community care in that instance. And then sometimes there could be an instance where the veteran and their provider at VA agree that seeking community care is in the veteran's best medical interest. So before the change that VA just announced went into effect, even if a VA doctor referred you to community care, you still had to have an additional clinical review, and that can cause delay and confusion, which we do not want for our veterans seeking healthcare treatment. The extra review is often seen as an unnecessary hurdle that was slowing down access to care.
And that's exactly why I think this change has been popular with veterans. It's also received a positive response from lawmakers that are saying that this removal of the added hurdle for veterans to receive health care, of course, I think everyone can agree that it's not a good idea for veterans to have these extra layers of review that don't really serve a strong purpose or a good purpose. On the flip side, there are some that say that extra layer of review with the 2 referrals would have made an impact, or was previously making an impact, as far as making sure that funds were being spent appropriately, and that any care that veterans could receive through VA medical centers was being provided so that everyone wins. The veteran gets care, and it also minimizes costs for the government. But I think overall, the response has been very positive, that there is no need for 2 layers of referral in every instance. And as Emma mentioned before, there are some specialties that are not available through VAMCs. So veterans who need a specific referral to a provider who does something specialized, it's really important for veterans to be able to get that in a timely way.
That's right. And you said something that we're going to talk about a little later when we get to VA's budget proposal, but is the spending. And so costs for community care have been increasing. So VA spent about $28.5 billion on community care alone in fiscal year 2024. So some of the folks that question this move and are a little bit concerned about community care question, should we be spending that money in the community on private medical health care, or should we be reinvesting that money into upping the services offered by our VA medical center? So that's, really where the line stands, and something we'll have to keep an eye on and certainly talk more about as we get further into 2025.
Definitely. And it's definitely in line, like you said, with the budget proposal that we're going to talk about in a few minutes, because healthcare is interestingly one of the biggest budget items in the proposal. This is not uncommon, but I think it's something that we have been really waiting to see what happened with this year's budget. There's been a lot of talk about cuts, not only to spending and allocated funds from the government, but also with employees. And so there were a lot of questions. I know we've talked about this internally about how are those cuts going to affect different areas of VA? How is it going to affect the healthcare side of things? How will it affect the benefit side of things? And so definitely the agreement of the importance of veterans being able to access care in a timely fashion at low cost, I think, is something that people have been able to support.
As always, we'll keep you updated as future developments come in, especially once Congress returns from the recess. Be sure to follow and like this video, and be sure to join our 100,000 YouTube subscribers for more content. Share this episode with fellow veterans, and don't forget to leave questions for future episodes, because we may be able to address those questions for you. Thanks for listening, and make sure to take care of yourselves, take care of each other, and keep the fight alive.